I've had two physical therapists here recently just sort of ask me about what the various options are as a PT for treating people. And so one who actually came to see me as a patient, but sort of trying to sort through now that he understands this, how it affects his work. And then another one who I think is just in a fairly conventional PT group at the moment, but is learning about TMS, very interested in it, and trying to figure out sort of how to branch off out into ways that she can use these ideas.
Yeah, I've had a number of patients who've been, especially recently, who've been either physiotherapists or osteopaths.
Yeah.
I think I've had a doctor recently as well. And it is interesting. And then, of course, it starts playing with your mind, because when you start thinking about what you need to do yourself and how it's affecting you, then it automatically starts affecting how it's going to impact you in your work moving forward.
Yeah.
And one physio recently I've been working to, he's actually a pediatrician. He's made the most amazing recovery and absolutely passionate about it.
Yeah.
He actually works with pediatric neurology, but at least he's, I started talking to him about, children with cerebral palsy, for example, and the impact that can have in later life as well. And I've treated a couple of people who I was asked to actually go in and go and consult with a local physio here, patients, two of them, cerebral palsy, and both of them about, because of the childhood struggles of being disabled growing up. And it was quite fascinating watching this very angry 15-year-old, and I was assessing her with the other physio there and her parents. And in the end, he managed to suggest the parents went off for a coffee, which we sort of planned beforehand. And it was only then that she started opening up. And then she had this very spastic arm to right up like this. And as she started opening up, it just stepped right down and opened up. And the physio was going, "Oh my God, look at that."
Yeah, it's amazing.
Wow.
And then, Liz, how do you incorporate this type of work into your practice?
Well, in the NHS practice, I basically only see them for 10 minutes.
Right.
So, so I saw somebody today who's 18 and she's had back pain, and she came in, lower back pain, had it for 2 years, no trauma, whiplash injury in 7 years ago. And basically came in with the kind of line that I've got this, my exams are coming up, I can't sit, nobody's doing anything type of thing. So basically what I did with her was I said, well, sometimes the thing about back pain, because she'd already had some, I think she'd had an x-ray done actually, which is quite impressive for a 16-year-old. Back x-ray, which showed a spina bifida change. And she'd been told that might be causing the pain, or she might have, I think it was SI joint dysfunction. She'd seen a few physios. And I said to her, well, I said, the thing is that with back pain is that actually the structural lesions do not fit with the pain. Sometimes, and there's other things going on, like sometimes emotional factors. So was there something going on at 16? Because it started in the middle of her GCSEs, which are her exams. No trauma, and she'd had this whiplash. And she said, well, it's nothing to do with stress, because I'm never stressed. I'm a very calm person. And I must admit, when people say that, so that's generally what I do. Simple answer. I kind of introduce it, and if they bite, then I say, well, there's this website, have a look at this. If I'm short of time, which I was today, I will just sort of put a toe in the water. And usually if they come back with that kind of response, I know it's time to go down the structural route for the moment. But kind of get bits of information that around the context. But she was very much in sympathetic overdrive. She was very quick to answer, very, talking very fast, fast breathing. But she didn't seem aware of it.
No, I'm sure not.
No. So
do you have a non-NHS practice too, or that's your practice within NHS?
I have a bit of a non-NHS practice. That's mostly NHS. So I have private rooms up the road. I see people there. So my plan is to actually do more of that. But it's kind of growing slowly. And I actually enjoy that work more than my.
I would imagine.
Yeah.
I think this is a funny story. So I had friends who lived in Great Britain for 10 years. They're from here, from the States. And whenever they'd come back, we'd get together with them, and they'd always end up talking about the NHS. And my friend, who's fairly conservative politically, would say, well, you know, it's actually not as bad as you would think if you don't mind only getting 10 minutes with your physician. But each year that they would come back and he would tell that joke, it got less and less funny in the States, because the amount of time that physicians in the United States spend with patients went down, kept going down and down. The average at the moment in the States is it's 15 minutes, but 7.5 minutes of those is spent charting. So it's really only a 7.5 minute visit. And in reality, I think my experience has been that the average visit in the United States is 2.5 minutes.
Gosh, that's incredible. That's incredible.
What can you do in that apart from just write out a prescription?
The only thing you do is write out a prescription. And I've had physicians who have literally said to me, like, if I wasn't going to write a prescription, what would I do? Like, physicians here have sort of lost the ability to think that there's anything to do other than that.
So sad. Well, John, we've given people time to join us, and it might be that somebody join later. So would you like to start anyway? I think if there's only 4 of us, if you're all right, we'll leave the screen as it is rather than, unless you want to fill the screen, John, it's up to you.
No, I think it's good to do it this way. I was thinking, Georgie, I would just talk a little bit about like how I learned about this in my own experience, and then kind of what I've done over time with my own practice that's been helpful for people. And so I first learned about TMS because of my own health issues in 1998, so 20 years ago now. And that was before I went to medical school. I graduated from college in 1991. I worked as a social worker for a number of years and was thinking about possibly switching careers and going into medicine, but I had to go back and take all my prerequisite classes and all the tests and everything like that. So I was in the middle of that process, and I fell down a flight of stairs and sort of popped up and didn't think there was anything wrong. But a couple months later, I started getting these strange symptoms that nobody could get a handle on. And like I was dragging my foot, and I had pain in that foot. And then there was pain in my hands and numbness and tingling, and went to primary physician who sort of didn't know what it was and sent me to a hand surgeon who examined me, and they thought maybe it was carpal tunnel syndrome, but it wasn't. And they did tests, and it didn't get better. And sort of that became, over about a 9-month period, like that became my life, trying to figure out what was going on and what the issue was. And I saw a number of different physicians. I saw an acupuncturist, I saw a chiropractor, I saw a napropath, which I think is specific to one region in the United States. And everybody kept saying, oh yeah, I know what this is, I'll fix it. But nobody would. And it came to sort of dominate my life. Like I couldn't talk about anything else. I couldn't think about anything else. I couldn't do anything. I couldn't do any activities. I have a very specific memory of being in a yoga class, like a yoga class for people who were disabled. And I was like doing a back bend, and there are 3 people supporting various parts of me. And I have this distinct memory of thinking, like, I was a varsity college athlete not that long ago. Like, how did I end up here? And it just sort of spiraled downhill. And then literally after about 9 months, I was at a cocktail party, and I was with a friend, and my friend had thrown out his back. And so it was kind of standing crooked like this, and we were talking, and a third friend came up to us, and he looked at my friend with the crooked back. He's like, I used to have back pain. It's like, but I don't anymore. We're like, really? What's that about? And he said he had back pain for a number of years, and one night he was hanging from his ceiling in his anti-gravity boots, like trying to stretch out his back. And he had this thought, like, this can't be the way this is going to get fixed. This can't be right. And this was, early 1990s, and so there was no internet back then. But he did some research, and he found Dr. Sarno in New York. And he called up he read Dr. Sarno's book, and he called up Dr. Sarno and said, I'd like to come see you as a patient. Dr. Sarno said, I'm sorry, I only take patients from New York, New Jersey, and Pennsylvania, and you're calling from Chicago. And my friend said, oh, no, I just moved to New Jersey. I still have the Chicago phone number. though. And Dr. Sarno said, okay, well, how about next Tuesday? And my friend said that he went and saw Dr. Sarno, and he did an exam, and he listened to Dr. Sarno's lecture, and the comment he made that night is like, by the end of that day, seeing him, being examined, talking with him, hearing the lecture, he said he knew where the pain was coming from. It wasn't coming from his spine, and he knew that he was going to get better, and he did, and had been better for several years at that point. So anyway, so he's talking about this, and I'm listening to the conversation, and I was like, I know who Dr. Sarno is. I'd always been interested in alternative medicine, and I'd done a lot of reading, and I had read Dr. Sarno's books before, but either like it hadn't clicked in because I didn't have back pain, or it just hadn't clicked in because I hadn't sort of associated what was going on in my life with the symptoms I was having. But I thought like, oh, like I know about this, that makes sense. So I went home from the cocktail party at the end of the night, and I got Dr. Sarno's book off my bookshelf, and I read it that night before I went to bed. I was like, oh, I see. And so I went to work the next day, and I came home, and I put air in I got my bicycle out of the basement, I put air in the tires, and I got on my bike, and I hadn't really done any physical activity in over 6 months. And so I rode the bike out to I'm in Chicago, so it's on the lakefront, and I rode out to the lakefront bike trail, and I started pedaling towards downtown, and it was excruciating. Like I kept like push on the pedal, and this pain would shoot into my leg and up into my hip, and these electric shock feelings. And every time I pedaled, I just kept saying to myself, this is not a physical issue. This is not a physical issue. This is not a physical issue. And it took about 3 miles, but eventually it started to relax. And for a long time, I told that story and then I got back home at the end of the ride and I was better. But that's not true. And so I was preparing for a talk a few years ago, and I found the journal that I kept in the aftermath of that. And I journaled about it for months afterwards. And I kept journaling like, is this really true? How do I know it's true? Nobody's examined me. What if this isn't right? What if I have a major injury? But eventually the journal entries got further and further apart. And then there's like a 6-week break in the journal entries and one last journal entry, and that was it. And for the most part, that was 19 years ago. I have lived pain-free since then. Like I never get headaches. If I hurt my back, it gets better in a couple of days. I ride my bike and have ridden 100-mile bike rides and exercise and play with my kids and throw them around the pool and essentially do whatever I want to do. And that's how I learned about it. And that was before I went to medical school. And so, so as applying to medical school, I was taking my prerequisite classes, I was taking the major tests that we have in the States for getting into school. And I was also thinking about getting married, which I ultimately did. And there were some spiritual issues involved. And so it was just too many things coming at me all at one time. And that's what made its way into my body. And then once I sorted it out, the pain didn't need to be there anymore. So I got to medical school, this is in 2001, and I knew all this. I knew that pain had psychological roots. I knew that what's going on in the spine doesn't necessarily reflect what's going on in the body. And I thought, well, this is great. Like I know all this knowledge. I'll tell people how this works and what to do about it. And I have a distinct memory of the very first time, like literally the very first time I saw an actual patient and not like a pretend patient in the lab. And she was in the emergency room because she had back pain. And I said to her, is there anything that's stressful that's going on? And she said, it's funny that you mentioned that because I called my boss a racist yesterday and I'm pretty sure he's going to fire me tomorrow. And I was like, oh, that's really interesting. And so I talked with her about this. And she's like, oh, that's really interesting. And I went back and I talked to the attending physician. I said, this is what I think's going on. And I'll never forget, the attending physician looked at me like I had 11 heads. Like he's just would not understand at all what I was talking about. And finally he's like, look, did you look at the MRI or did you not look at the MRI? And that was his response. And so, so that was my first lesson in it. It's not going to be just as easy as explaining this concept to people and people will get better. But I tried to sort of keep a hand in the alternative, more integrative medicine world as much as I could. One of the things I did when I was a student is I made a vow that whenever I saw somebody who had pain, I would ask them what was going on in their lives, or is anything stressful was going on. And people would tell me these amazing things when I asked these questions. And, you know, I tell this to medical students now, like the one advantage that medical students have over everybody else is they have time when no one else does. And so I would sit and I would talk with patients and they would tell me these incredible stories. And I didn't have the knowledge base or the authority then necessarily to help them get better, but it showed me that, yes, very frequently when people have physical symptoms, there's something going on underneath the surface. One really stark example of that, when I was a student, I was working in the urgent care clinic and somebody came in with a migraine. And I asked her that question, anything stressful going on? And it turned out like she'd had a daughter who had died of an asthma attack like 6 months before. And we talked about it for a little bit and she told me about her daughter. But my recognition there that was really helpful is that this physical pain has this currency that emotional pain does not. And so if you're grieving, you can go to your boss and say, I have a migraine, I need to go home. And your boss says, okay, I understand that. But you can't really go to your boss and say, like, I know it was 6 months ago that my daughter died, but I'm having a really hard day and I need to go. And as I'm saying that, like, these days, you know, maybe you can start to get away with that depending on who the boss is and who the situation is. But 10, 12 years ago, when I talked with that patient, there's no way that anybody would have understood that emotional pain can be that acute that you need to leave. And so, anyway, so I did that kind of work whenever I could, and I did a number of different electives in health and healing and alternative medicine, and I ended up choosing a residency in Michigan in the States that allowed me to do both a traditional general practice residency plus some additional work in integrative medicine. And so I chose the program specifically for that. And a couple months after I moved to Michigan, I was hunting around on the internet for Dr. Sarno in TMS, and Howard Schubert's name popped up for the first time. And I was in Ann Arbor, which is in Southeast Michigan. He's in Detroit, which is about an hour, 45 minutes to an hour away from where I was. And so I called him up and said, you know, I'm in Michigan. I just started my residency. I'm interested in this work. And he had just started doing this. Like, he had just learned about it. He had spent some time with Dr. Sarno. He had just opened a new program. And he was like, that's great. That's great. I don't know anybody else who's interested in this. Come over here to Detroit and meet me. And like, I had no idea. And Georgie, I don't even know if you know, like, he's got a national award named after him.
Really? No, I didn't know.
He's a big deal. And the very top resident in the country who trains in both medicine and pediatrics wins the Howard Schubiner Award.
Wow.
No, I know. Yeah.
Gosh.
And so, you know, so he's published however many dozens of papers, and was a full professor at Wright State University in Detroit. And so I had no idea how big a deal he was. And I just, you know, I'm a medical resident first year. And so I just drive up and talk to him. And he's like, this is fantastic. Like, he, you know, literally didn't know anybody else in the area who was interested in doing that work. And so I spent a lot of time with him while I was doing my medical training. And I would drive to Detroit and I would see patients with him. And many of you probably know his book, Unlearn Your Pain. But back then it was just a little pamphlet. And it was these exercises that he had put together, and he would give them out to patients who were interested or had found his name that way. And we'd run groups like this size. It'd be like 4 or 5 of us who were there. And we'd kind of listen and provide feedback. And that's what we did. And then, you know, as I progressed in my training, it really was like I gained the authority to talk with people about this. And so I remember patient number 1, which was the end of my second year of residency training. And a woman came in with migraine headaches, and we talked about a number of different things, including Dr. Sarno's book. And she was in between undergraduate and grad school, she was applying to school in PhD psychology programs. So she was psychologically aware, and the concept made sense to her. And so I gave her some assignments and told her to read Dr. Sarno's book, and she went home. And the story she told me after that was, you know, she read the book and it made sense, but the migraines just stayed. And like 3 weeks after she read the book, she had a really, really bad migraine. And it was Saturday afternoon, she sat down on her sofa and her boyfriend was there with her. And she said, you know, I saw this guy and he said the migraines might be stress related, and this bad migraine's been going on for 3 days. She's like, but I can't for the life of me figure out what's stressing me out. And she said her boyfriend said, like, I don't know what's stressing you out either, but whatever it is, maybe it's the same thing that's caused you to clean, to clean the house maniacally over the last 3 hours. And she said she burst into tears, and when she stopped crying, the migraine was gone. And so she came back to see me in the clinic the next month, and she was telling me that story. And I was like, yeah, that's great. And you know, she's like, the migraine didn't come back. And the way residency works here in the States is if you're seeing a complicated patient, and there's formulas of what's complicated, the attending physician has to come in and actually look at the patient. And so like I went out to tell the attending physician, who's interested in integrative medicine and is a pretty good friend of mine, but she was totally skeptical about this concept. And so I'm explaining this to her, and I was like, yeah, the migraines are gone. She's like, no way. Like, yeah, come on, come look, come meet her. So she walks into the room and she says to the patient, like, so Dr. Stracks tells me that that you had migraines. She's like, oh yeah, like every other day, and they'd last for 36 hours. And the attending said, and you read a book? And the patient said, yeah, I read a book. And she said, and the migraines are gone? And the patient said, poof. And so that was the very first time that like I had taken this knowledge and transmitted it to somebody, and they'd been able to use it and find relief. And so that was an important point for me, because like the knowledge is great, but until there was some way for me to transmit it, it didn't matter so much.
Can I just ask, did she work out what it was that was causing her migraines? Was it not wanting to clean the house and having to?
Right. I don't know that she told me or knew exactly what it was. And so there's two important points about that. One, like she was just living a stressful life in general. Like she's in between undergrad and grad school. She wasn't sure if she could get into grad school. She was doing her applications. Like she had this really stressful boss in her lab. She had some family issues. Like there was a lot going on. And so that may have been a lot of it, just, and sort of what, you know, what I said about me, just too many things coming together all at once. The other thing, and I've heard, most of you, I think all of you know, Dr. Sarno passed away last year, but, you know, I've heard him say that the first time he recognized this, same kind of thing. He had a migraine. He's like, oh, somebody told me that migraines are stress related. I wonder what's stressful, or anger maybe. And like he thought about it and thought about it and thought about it and couldn't come up with anything. But after the thinking, there was no more migraine. And so at some level, in some people, like you don't have to know what it is. You just have to know that that connection
could exist. Yeah. Okay.
The opposite is true sometimes too. Like sometimes you do have to figure it out or take care of whatever situation it is. But there are times when just knowing about it is enough. And there are times when it's not anything in particular, but just too many things going on all at once. So anyway, and so I kept talking with patients about this, and then I spent an extra year in Michigan at the Integrative Medicine Center there, and one of the things I did that year is I took Dr. Schubiner's group and I ran a couple on my own in Ann Arbor. And so I would see patients, we would talk about this, they'd think that it made sense. And so they'd come in like each week for 2 hours I think we did it for 4 weeks, with the idea that like they'd work on Dr. Schubiner's workbook when they weren't there at the clinic. And then when they were at the clinic, we'd have a discussion about what was going on. And it actually worked pretty well. Like people had some pretty significant relief from it. And then So when I finished my medical training in 2009, which was like the worst year to look for a job in the history of looking for jobs. And, but I kind of lucked into a good job in Chicago, where I'm originally from. And there's an alternative medicine center that was attached to a big hospital here. And they happened, despite the recession, they happened to be expanding. And so I joined their staff in 2009. And I said to them, like, I'm not coming unless I can do this TMS work also. And, you know, it was an alternative medicine center. And so I don't know that they knew exactly what it was, but they were open to it. And pretty soon after I got there, I opened up these groups. And it was that model. Like, I'd tell them, work on Dr. Schubiner's workbook and come each week for 4 weeks. And the first week, I'll give you a 2-hour lecture of the evidence as I see it for the relation between mind and body. And then come back each of the next 3 weeks and we'll see what's going on. And same thing, like, not everybody got better, but people did. And like, I remember one girl who had back pain. She was only 20. She had back pain for 5 years. And I knew her, or I knew her family. And so there's some connection there. But, you know, she was thinking about dropping out of school, and we talked and it made sense. And so she came back the first week. She's like, I think I get it. And then she came back the second week. She said, I'm better. This is great. I'm better. And then the third week she skipped it because she went to a hang gliding lesson. And that's a true story. Like, she skipped it to go to a hang gliding lesson. And so I've kept doing, and I still do some version of that group. I've expanded it now, and so it's 6 weeks in length instead of 4 weeks, but the format is the same. There's a lecture the first week. I go over the evidence. I have people read Dr. Schubiner's book, Unlearn Your Pain. I assign them various writing exercises. And then they come back each week for a couple hours and we have a discussion. And I check in with everybody and say, what's going on, what's working, what's not working, where do things stand, what questions do you have? And we sort of go one by one and check in with everybody. And we end up over that 6-week time period talking about a lot of the same themes. And so what's helpful, thinking psychologically, recognizing emotions, setting boundaries, doing the writing, doing the meditation, being kind to yourself, quieting the negative voice, reducing the catastrophic thinking. Those topics tend to come up, and I don't have specific exercises that I'll assign about those, but frequently we'll talk about them in a group. And I think it's useful for people. Some people are better by the end of the 6 weeks. Some people are just getting started. Sometimes people start to uncover some pretty significant things in their past and get referred to psychotherapists. And more, I'm trying to have people branch out and use all the various tools. And so sometimes people will work on the TMS Wiki program and have people listen to the Curable podcast or do some of the Curable exercises. And we're just sort of looking for each individual, what's going to help them progress. And, another thing that Dr. Sarno used to do is he'd invite his patients who were doing well to come to New York University and give talks. And so Nicole Sachs, who's a psychotherapist, she and I did a webinar last week. She used to sit on that speakers panel for Dr. Sarno, and every month she'd go into New York City and tell her story while other people could listen and answer questions or ask questions. And so I started doing that. As people got better, I would say, hey, do you want to give a talk? And so we'd get together, and sometimes it was 5 or 10 of us, and then it was 20 or 30 of us. And people would talk about their experience, and people would answer questions or ask questions and get answers and share ideas. And then periodically I've invited other experts in the field to give talks or webinars. And so I was telling Georgie before we started, like, I've had David Clark talk, and one time we couldn't get the IT to work, but it was okay. And, he talked about his experience. I've had Dr. Schubiner talk. I've had Alan Gordon talk. I've had Nicole talk. David Hanscom did a talk with me a couple of months ago. And so I have just given people the opportunity to enter into this, to be around me when I'm talking about it, and giving them permission to think this way. And I think one of the really good things about the groups is that they can think this way and they can be open about it, because if you're just kind of randomly put down into a group of people who don't understand it, you start talking about how your migraine headaches are related to something that happened to you when you were young. People don't want to hear that, and they don't know what to say about that. And so the groups and the panel discussions and the other events that I have are a really nice way for people to be able to talk about this safely amongst other people who understand and are encouraging of it. I worked for the hospital for 8 years, and about 3, maybe 4 years ago now, I recruited to work for another hospital, and I thought about it seriously and decided not to. But about a year and a half ago, I decided that I'd sort of reached the limit of what I could do in a big hospital setting, and started trying to figure out what else I could do that would allow me to do more of this work. Because at the hospital, the TMS work was maybe 2% of what I would do in any given week. And so a couple people might come and talk with me. I'd have a couple of people in my groups. And so ultimately, I kind of made up this story that people just weren't that interested. Like, the work was too hard and it was too esoteric, and people couldn't latch onto it. But for a variety of reasons, I decided I needed to do something different. And so I left the hospital at the end of last summer and set up my own small solo practice in Chicago, in the Chicago suburbs. And almost immediately, people started calling to want to get seen for TMS. And so within the first month, I probably had as many people call as would call me at the hospital in a year. And there are a variety of reasons for that, but it wasn't that people didn't want the treatment, is that the treatment is very hard to access within a big hospital conventional medical setting. And now that I'm a smaller group in my own practice, it's much easier for people to find it, call, schedule appointments, get information about it, join my groups, join my webinars. The last few webinars I've done, we've had usually 60 to 70 people on the webinars. And then for the most part, I've been able to record them. And so this last one that I did with Nicole 2 weeks ago has been viewed almost 500 times.
Wow.
Now. Yeah. And, I've got it on my website, and Nicole's got it on her YouTube channel, I think, and sent it out to my patients and encouraged them to send the link to their friends and colleagues. And so really are slowly but steadily making this more available, more accessible for people, easier for people to talk about. The Curable app, which Georgie knows I'm involved with, I'm the medical advisor to the app that they created a couple of years ago, and they've been doing a lot to publicize these ideas. And so I, among other things, I recorded me talking about my own story for them, and they began to turn that into a podcast series that's been fairly successful at this point. They've got 15 or 16 episodes, including one with a physical therapist. If you haven't listened to that, they recorded that just a couple of weeks ago. They had one patient who migrated to their app and made her migraines get better. And it turned out that woman's husband was a major writer in the internet world, and he put out a blog post about how she had done this. And so just very slowly but very steadily, we're increasing the reach of who we're able to tell this to, and how much easier it is for people to access this. The Curable folks asked me to do a blog post on a medical student website a couple of months ago, so we put that up. And the focus on that was the opioid crisis, which is bad in the States, and I assume is bad in Great Britain also. And this idea that, it used to be that people would come in with pain, and as a society would say, we're not great with this. But now, people come in with pain and we're killing them, which we can't do anymore. And we need to have different answers. And this is one of the different answers that people need to be made aware of, and that people can latch onto. I guess, one other thing, sort of thinking about those of you who are listening, I went from talking about this but not having anybody respond to talking about this regularly to people who want to listen to it. And that's just been part of my own progression. I think putting myself in situations where people are more likely to be interested and more likely to be able to hear what I'm saying. And so, I started my career as a medical resident in a low-income clinic outside Detroit. And whether people were interested or not, when people are just trying to figure out where their next meal is coming from, it's hard to latch onto these ideas. But as I progressed, gained more authority, worked in places that people were coming because they were interested in more alternative ideas, they were interested in more non-medical solutions, became easier and easier for me to talk about it and have people hear about it. And I became less and less worried about offending people with what I say, which I still do occasionally. But at this point, like, it's my own clinic. People are coming because they want to talk with me. I don't take insurance. And so they're there because they really want to be there. And I don't have qualms about telling people that there's this connection between mind and body. And if they don't take a look at that, then they miss a significant portion of their ability to heal. And so that's been kind of my experience going from, learning about this before I was in the medical world to now having my own clinic, where one of the goals is to really increase knowledge and awareness of this and the effective treatments as much as I possibly can. So anyway, I will pause there and see what questions people have.
Fantastic, John, and I think really inspiring for people who listen to this, because like you said, you made an effort to set up a group, and then you put yourself out there and put yourself out there to reach people.
Yeah.
And when I started, when I was working more locally, I did what you did, and I used to run a monthly group. And then have people coming in and talking about their story. And then sort of Serpa took off, and I was left able to do that. I'm always encouraging people to do that. And I think for you to have shown here that, but when you sorry, ignore that phone, it'll stop it, won't it? So you're actually showing here what you've been able to do with your own business by taking action, getting out there, and making it more available. And I think it's so important to do that. And anybody who's trained in this and who's got a really good understanding that there's no reason why they can't set up a group and start getting people more aware of them.
Yeah.
Fantastic, thank you.
Yeah, you're welcome. Let's see. Yeah, questions?
I was thinking that I've recently been down to meet an osteopath's clinic, and it's a really lovely setup. And while I was down there this week, I was thinking, oh, that would be a really lovely place to do a group. So, but yes, it is finding a way to spread the words and speaking to the local GPs. I do wonder whether the fact that I'm a physiotherapist, everybody just assumes I'm just, if I'm saying that I, help people with chronic pain, that I'm going to be giving them just a bunch of exercises. And I think it's getting over that that initial hurdle, to be honest, that it isn't exercises or manual therapy. That it is something different.
How are you all going to promote yourself, though, Catherine, isn't it? As much as in that's where I came from being conventional, and moving towards the alternative therapies. And for me, this was not a halfway thing. I needed to really go for this. But it was actually being really clear and focusing on the benefits for them rather than focusing on how we do it, but actually, and really looking at your marketing and how you're getting out there, how you're explaining it more than anything.
Yeah. It all it's a learning curve for us all, I think, isn't it?
It is, absolutely, and it's about doing it. That job that started, it wasn't quite so successful, and then you learn as you're going along, don't you?
Yeah, absolutely.
And as you start having patients who respond, like, that's a very good selling point too. Like, they may go back.
They'll tell their friends,
or tell their friends, and
you record their stories, and you get them to write their stories, and then you spread the word with that, definitely.
Yeah, I think as it's a bit of a snowball effect, I think, really, isn't it? As you get sort of a few people who've told others, then that it gets just more and more and more, and the word spreads around, like you said you have in your clinic over the last 6 to 9 months.
Yeah. I think that's definitely true. And, you know, it's interesting sort of thinking about what you can do for physicians, because physicians, obviously, they're A, very busy, and B, like, they just don't have great tools to treat people's pain. And so certainly if there are ways to connect with physicians and say, like, you know, your patients who aren't getting better, like, I'd love to talk with them about this. And you know, some physicians may say, like, you know, all right, that'll be great, I don't understand what that is, but if you have ways of helping, you know, happy to send them. And so you can start to get some of those people, and they have to be open to this idea, right? If somebody comes in and thinks that you're going to give them exactly the right exercise, then it's missing the point. You know, when I worked in a clinic where the expectation was to give them a medication, like, they weren't going to respond to this necessarily. But as I've had more people who have told other physicians, like, I get referrals from physicians, sometimes do this, sometimes physicians say, like, I don't understand exactly what he does, but he's helpful enough that you should go talk with him. And so there are definitely other physicians who will refer to me if they think that this can be helpful. I saw somebody yesterday who sees a physician who's a friend of mine, and had pelvic pain for 20 years, but had a really good discussion with her about how this happens and who it happens to and what to do about it. And so, so over time, there's definitely been a network amongst physicians who are open enough that they will think about this.
Yeah, and as Georgie says, you're selling the benefits of it, not the how. If they're not particularly, the other physicians aren't particularly worried about how you're achieving it, as long as you're. Yeah.
Right.
We have enough recovery stories that anybody can share now, and most GPs will have people going in and giving talks, and certainly I went and gave talks to all the local GP practices years ago when I came across this, and just to try and raise awareness of it and just see what interest there was there. So that's something definitely that they are usually open to.
Yeah, I have taken on, I've had another physio who's helping me with my business side of things, but one of my jobs this week is I have got to contact the local GPs.
All right. When you're told you're working with them, you have to, don't you?
Yeah, so, you know, the universe is telling me.
Yeah. And one of the advantages too, like, as a physician, there's always, amongst other physicians, like, you know, am I going to take their patients away from them? But you don't have that barrier. Like, they're not going to come to you to get the medical treatment. They're coming to you for a specific reason. And so it's a little bit easier conversation to have. Like, you're not stealing patients. You're just going to partner and do something that they have trouble doing, which is treat people's pain.
And reduce the costs of their practice.
Yeah, absolutely. Yeah.
That's the thing, isn't it? It's getting the idea across. And I think I still work in the NHS as well. And that what I find is that there's a lot of negative talk from GPs in terms of, I mean, I had a guy the other day who he thought it'd just get better because he'd injured himself, and the GP sent him for an x-ray and said, you've got 3 choices. You can either have an injection, a knee replacement, or just take on board that you'll be on a mobility scooter. Right. And the guy was fine, you know, he did any of those things. And to try and get out there as well and stop, even if they don't take on board the TMS, to stop giving people such negative diagnoses, really, that are unfounded.
Yeah, they're totally unfounded. Physicians don't understand the power of their words. Like, they don't understand the nocebo response. And physicians are saying things like that all the time. It drives me crazy. You
have to unwind it.
Yeah. One of my very most successful patients came to me initially. Like, I never know exactly how to interpret this story, but the story she told me is that she was a bit of a hypochondriac, so she would frequently go into her physician with this or that. And I feel like the story she told me is that one day her physician just snapped. Like, she just couldn't tolerate it anymore because she came in and said she had this numbness and tingling in her hands. And she said, the physician said, I think it's MS, and I think you're going to be in a wheelchair within 5 years.
Oh, God.
And she's like,
oh, my word.
And so she found her way to me. And in the end, like what the tingling was, is she had been home with her kids for a long time. She was getting back out into the business world. She had this idea she was super excited about, and she was tingling with excitement. Like that's what it was all about. And I mean, she's done fantastically. And my sense wasn't that like that her old physician, like I don't know that was her personality. I just feel like it was just like one time too many.
Yeah.
But that was the story she told. Like this was an unacceptable answer from another physician.
Well, I was quite impressed when a few years ago now I was asked to speak at the British Institute of Musculoskeletal Medicine, and that is all GPs.
Yeah.
But the speaker before me was talking about the nocebo effect, and actually was saying to the GPs, "What's your language? You know, what's what you're saying to your patients?" And I was sitting there going, "Yes, that's fantastic." But people are still they're not aware of the evidence base. They're not aware of what they're saying and the impact it has, or the majority of them don't. And so it's still a long journey, I think.
Yeah, it's a long journey. One of the things that I'm finding, and I don't know how applicable this is to the other people on the call, but my practice has been incredibly successful because I'm able to offer some basic things that other physicians can't, like eye contact, answering the phone, caring about people, listening to what they say, like just basic human decency things that have been kind of moved out of the medical system at this point. And at least in Chicago, people are kind of starving for that kind of care from people, and people will like move outside of insurance and pay me directly and be appreciative of the opportunity to be part of the practice. Like it's been, and like I thought it would be successful or I wouldn't have done it, but sort of so much more than that. And I think a lot of it is just because like I'm still able, unlike many physicians these days, to connect with people on a personal basis. And people miss that. And so so I wouldn't underestimate the power of just being able to connect in a world where that's increasingly rare, especially in the medical system.
I have to say, I've people who have come and have been interested in it, they are very, very willing to chat.
Yeah.
And to, you know, you have to obviously guide them, but they just love the fact they can just sit and chat and begin to see those connections and the realization. You mean that is to do with that, you know, and it's lovely. And that, yes, you're right. They just welcome the time.
Yeah.
And that's why I'm very keen. I do spend an hour and a half. I don't know if that's a huge amount compared to other people, but I like to make sure I've got plenty of time.
Yeah.
Per session.
I'll spend an hour and 15 minutes with new patients.
Right. Yeah.
So yeah, I think that's the kind of time you need to let the story unfold.
Yeah. Well, thank you so much, John. I really appreciate you spending some time with us. And I know that even though there aren't that many people on the call at the moment, that there will be many more people who'll be able to watch this. We have recorded it, I did remember, even though nobody reminded me. But yeah,
Georgie, I can see the little recording button in the corner of my screen, so I knew that you had turned it on.
Oh, yes, that's true, because you're a co-host. No, that's great. But no, I really appreciate you spending the time with us, John. And one of the things I should want to mention as well is the article or piece that you wrote about migraines. I think it's really good, and I often share that with
good.
Specific to migraines, but I think it's really good. So
good.
Great. Well, thank you very much.